Hello friends, welcome to this exercise series. In this series, we will examine the benefits of physical activity using a landmark studies, large modern cohort analysis and recent systematic reviews. We will not simply say exercise is good for you. Most people already know that. Instead, we will ask some practical questions. How little activity can still help? Does exercise benefit me if I am overweight? What if I have obesity? What if I have smoked previously? Does more exercise always produce more benefit? And what does the evidence actually show about cardiovascular disease, cancer, and longevity? Why did I decide to make this series? Because patients often tell me in the clinic, Doctor, please tell me anything except exercise. Give me a tablet, capsule, give me an injection, but please don't ask me to do exercise. I genuinely understand exercise requires time, effort, and consistency. Swallowing a tablet takes few seconds. Walking for 30 minutes requires negotiation with your knees, your schedule, your family, and sometimes your own mind. But the evidence supporting regular physical activity is too important to ignore. So, in this series, we will examine the evidence carefully and make it enjoyable enough that you do not feel you have returned to a classroom after a tiring day at work. Let us begin with a mystery from 1953. Two men worked with the same London transport system. One man spent most of his seated behind the steering wheel, the driver. The other walked through the bus, issued tickets, and repeatedly climbed the stairs of a double decker, the bus conductor. One sat, the other kept moving, and their hearts told two different stories. Researchers studied approximately 31,000 male London transport employees aged 35 to 64. The age adjusted annual incidence of a first coronary heart disease episode was approximately 2.7 per thousand among drivers, compared with 1.9 per thousand among conductors. But the difference in severity was even more striking. Immediate mortality was approximately zero point 0.9 per thousand among drivers, compared with 0.4 per thousand among conductors. Among those who developed coronary disease, almost half of the drivers died within first 3 months, compared with approximately 30% of the conductors. The researchers concluded that the conductors developed less coronary heart disease appeared to develop it later and experienced less severe disease. The conductors were not attending a gym, they were not calculating zone 2, they were not taking photographs on the bus stairs and posting. Leg day completed, no excuses. They simply moved much more during the working day. Now, this was an important study, but it was published in 1953. It was observational, so it could not prove that physical activity alone produced the difference. The researchers themselves considered other possible explanations, including job selection, body constitution, and differences in occupational stress. But they found a similar pattern when they compared physical activity postmen with relatively sedentary clerks, executives, and telephonists. The postmen had lower coronary disease incidence and lower early mortality. That old study opened the door. Now let us move quickly to the larger and more modern evidence. Imagine our Doraisamy returning home after work. Doraisamy enters slowly, drops his bag, and collapses dramatically onto the sofa. He is exhausted as though he has completed a mountain expedition. His wife Kamala, please bring me some tea. And I have worked continuously for 8 hours. Kamala looks at him, slowly raises one eyebrows and asks, Really? Really? You sat in the office, you sat during lunch, you sat in the car, and now you are sitting to recover from sitting. Which part was the physical activity? Doraisamy mildly got offended. I moved the computer mouse throughout the day. Kamala replies dryly, Wonderful, your mouse is extremely fit. The doorbell rings. Meenakshi enters, the neighbor. Looking concerned, she asked what happened. Why does he look as though he has completed a marathon? Kamala points towards the sofa and replies calmly, He traveled from the office chair to the car seat and from the car seat to his sofa. Long distance sitting. Doraisamy sits defensively. Please don't underestimate office work. Today I climbed 4 floors. Kamala suddenly looks impressed. Really? Doraisamy hesitates and reluctantly admits the lift was not working. Kamala narrows her eyes when Doraisamy quietly 3 months ago. Meenakshi nods sympathetically. Recovery from stair climbing can be emotionally difficult. Many people are genuinely exhausted after work. They have managed deadlines, traveled through traffic, answered calls, made decisions, and dealt with family responsibilities. Their brain feels tired, but their muscles may have spent most of the day almost completely inactive. So the question is not, can everyone become an athlete? The practical question is, how much physical activity is enough to begin producing a meaningful benefit? For that, let us examine the study by Stephen Moore and colleagues. In 2012, the researchers pooled information from 6 prospective cohort studies. The analysis included over 650,000 people. The median follow-up was approximately 10 years, and during that period, there were 82,465 deaths. The researchers examined moderate to vigorous leisure time physical activity and estimated differences in life expectancy after the age of 40. This was not a randomized trial. Physical activity and body weight were largely self-reported. Therefore, the results show population-level associations. They do not guarantee an exact number of additional years for any individual person, but dose response patterns were striking. Doraisamy leans forward and asks anxiously, "Doctor, please begin with the smallest possible number. Don't immediately attack me with 450 minutes." Compared with people reporting no moderate to vigorous leisure time activity, an amount equivalent to brisk walking for up to 75 minutes per week was associated with approximately 19% lower mortality risk and an estimated 1.8 additional years of life expectancy. 75 minutes per week averages to less than 11 minutes per day. Doraisamy looks genuinely surprised. Wait, around 10 or 11 minutes per day was associated with a measurable difference? Yes. Not a guaranteed 1.8 years for one particular person, but a meaningful difference across a very large population. Kamala turns slowly towards her husband and says, "Enanga, you spend 11 minutes choosing what to watch." Doraisamy explains seriously, "Choosing the correct program requires concentration." Kamala replies firmly, "Today, choose while walking." Here is a full dose response pattern. Compared with reporting no moderate to vigorous leisure activity, up to 75 minutes per week was associated with approximately 1.8 additional years of life expectancy. Between 75 and 149 minutes per week, approximately 2.5 additional years. Between 150 and 299 minutes per week, 3.4 additional years. Between 300 and 449 minutes per week, 4.2. At 450 minutes or more per week, approximately 4.5 additional years. Notice the shape of the relationship. The first increase from no activity to a modest amount produced a large difference. Further activity was associated with additional benefit, but extra gains gradually became smaller. This is called a curvilinear dose response relationship. Some activity is much better than none, and the more is generally better than some. Activity does not necessarily produce twice the benefit. Doraisamy takes out his phone and begins calculating. So if I walk 150 minutes every week, I will receive exactly 3.4 additional years. Isn't it, doctor? No, you cannot reserve those 3.4 years in your calendar. These are adjusted estimates from an observational study. Your personal outcome also depends on the smoking habits, blood pressure, diabetes control, cholesterol, body composition, genetics, sleep, diet, existing medical conditions, and many other factors. Doraisamy looked disappointed. So there is no certificate. Kamala replies reassuringly, "I will give you a certificate after 7 continuous days." Doraisamy suddenly interested. "Is it government recognized?" And Kamala smiles calmly and says, "Household recognized certificate, which is more powerful." Meenakshi asks thoughtfully, "Doctor, many people think first I must lose weight. After losing weight, I will begin exercising." What did the study find in people who were already overweight or obese? This is one of the most useful things from this Moore's analysis. The association between the physical activity and longer life was seen across every BMI category. In this analysis, being active meant reaching at least approximately the recommended minimum activity level, roughly equivalent to 150 minutes of brisk walking per week or more. Within each BMI group compared with active people, inactive people of normal weight had approximately 4.7 fewer estimated years of life. Inactive people who were overweight had approximately 3.9 fewer years. Inactive people with class 1 obesity had approximately 3.4 fewer years. And inactive people with class 2 or greater obesity had approximately 2.7 fewer years. These are adjusted observation estimates. They do not mean that beginning exercise automatically adds exactly that number of years, but they answer an important question. Physical activity was associated with meaningful benefit even when weight loss had not yet occurred. Now listen carefully to this comparison. A normal weight but inactive person had approximately 3.1 fewer estimated years of life than an active person with class 1 obesity. Doraisamy widens his eyes and asks, really? An active person with obesity may have a better estimated life expectancy than a thin person who never moves. That was the association in this study. It does not mean that body weight is irrelevant. Being physically active and maintaining a healthy body weight composition are both valuable. At two extremes, being active and normal weight was associated with approximately 7.2 more years of life expectancy than being inactive with class 2 or greater obesity. The correct message is thinness alone is not a fitness certificate. Meenakshi asked curiously, so the weighing scale does not tell me about cardiovascular fitness, muscle strength, or insulin sensitivity. Exactly. A weighing scale measures mass. It does not measure how efficiently your heart works. It does not measure the muscle strength. It does not measure the cardiorespiratory fitness. It does not measure how effectively your body handles glucose. And it does not measure habitual movement. Kamala looks directly at her husband and asks, did you understand? Doraisamy replies confidently, yes, we should never judge anyone only by the body weight. Kamala responds patiently, I was asking whether you understood the exercise part. Doraisamy answers quietly, I understood the emotionally comfortable section first. Meenakshi now asks seriously, what about someone who smoked previously? Some viewers may believe that previous damage means that becoming active is no longer worthwhile. The MOVE study also analyzed participants according to smoking history. Among former smokers, compared with former smokers reporting no moderate to vigorous leisure activity, up to 75 minutes per week was associated with approximately 2.2 additional years of estimated life expectancy. Between 75 and 149 minutes, approximately 2.8 years. Between 150 and 299 minutes, approximately 4.1 years. Between 300 and 449 minutes, approximately 5 years. And at 440 minutes or more, approximately 5.5 years. Again, these are associations, they are not guaranteed personal outcomes, but the results suggest that a former smoker still has much to gain by becoming physically active. Doraisamy asks cautiously, what about someone who continues smoking but also exercises? And that expression becomes serious. The study also found an association with longer life among active current smokers at the highest activity category. The estimated difference was approximately 3.5 years compared with inactive current smokers. But the physical activity does not cancel the harms of smoking. Exercise does not convert a cigarette into a health product. The ideal combination is stop smoking and remain physically active. Do not choose one healthy behavior and expect it to erase another major risk. Kamala asks firmly, like eating one salad after an entire week of sweets? Doraisamy looks away and asks suspiciously, why are all the examples directed towards me? Kamala smiles sweetly. Coincidence, purely observational. The MOVE study also reported associations with a longer life among people with a history of heart disease or cancer. At the highest activity report, estimated life expectancy was approximately 6.2 years higher among those with history of heart disease and 7 years higher among those with a history of cancer. However, these subgroups findings need particular caution. A serious illness may itself reduce a person's ability to remain active. That can make the difference between active and inactive groups appear larger. This is called reverse causation. These figures must never be treated as an individual exercise prescription for someone with active heart disease, ongoing cancer treatment, or another major illness. In such situations, exercise must be appropriately assessed and individualized. Now, Doraisamy may reasonably ask, that is one large study from 2012. What does the wider body of evidence show? Yes, in 2023, Leonardo Garcia and colleague published a major systematic review and dose response meta-analysis. It included 196 publications, 94 prospective cohorts, more than 30 million participants, and the all-cause mortality analysis included more than 163 million person years and over 8 lakhs 11,000 deaths. The researchers examined non-occupational physical activity that includes activities such as recreational walking, cycling, sport, and planned exercise outside work. They found strong inverse non-linear dose response association across all-cause mortality, cardiovascular disease, cancer mortality, and severe cancer outcomes. In, in plain language, as activity increased, risk generally decreased. But the largest relative improvement occurred when inactive people began doing some activity. A brief technical point: Moore and Garcia used different measurements of physical activity. Moore used conventional Met hours. The Garcia used marginal Met hours, which removed the resting energy component. Therefore, their numerical Met hour values should not be directly compared. For this video, I am translating them into approximately weekly minutes of moderate activity. Now, Doraisamy asks in a negotiating tone, suppose a person agrees to exercise, but only half agrees. What happens at approximately 75 minutes per week? At approximately 75 minutes of moderate activity per week, compared with inactivity, Garcia and colleagues found associations with 23% lower all-cause mortality, 19% lower cardiovascular mortality, 10% lower cancer mortality for developing cardiovascular disease rather than dying from it. Total cardiovascular disease incidence was approximately 17% lower, coronary heart disease incidence approximately 14% lower, stroke incidence approximately 14% lower, heart failure incidence approximately 10% lower, and total cancer incidence was approximately 7% lower. The researchers also calculated a population impact estimate. They suggested that if everyone achieved even this amount, approximately 1 in 10 premature deaths might potentially have been prevented. That calculation assumes that relationship is causal. It is a modeled population estimate. It is not a prediction for an individual viewer. Doraisamy looks visibly relieved. So, half the recommended amount is not a failure. Correct. It may not be the final destination, but it can be an excellent beginning. Meenakshi asks enthusiastically, now give us the standard target. What happened at approximately 150 minutes per week? At the equivalent of approximately 150 minutes of moderate activity per week compared with inactivity, all-cause mortality was approximately 30% lower. Cardiovascular mortality 29% lower, cancer mortality 15% lower, and the total cardiovascular disease incidence was approximately 27% lower, coronary heart disease 21% lower, stroke 20% lower, heart failure 16% lower, and total cancer incidence was approximately 12% lower. The researchers estimated that if insufficiently active adults achieved this activity level, potentially 15.7% of premature deaths, 12.3% of cardiovascular deaths, and 7.1% of cancer deaths might have been prevented. Again, this is a model population estimates based on observation associations. Doraisamy asks, hopefully, can I take the entire 150 minutes as one weekly dose? The activity can be accumulated in different ways. For example, 30 minutes on 5 days, approximately 20 minutes daily. 3 sessions of 50 minutes or several shorter periods accumulated across the week. Doraisamy asks carefully, can I do all the 150 minutes on Sunday night at 11 o'clock? Kamala stares at him in disbelief. After sitting from Monday morning until Sunday evening, Doraisamy replies softly, I was exploring the flexibility. Kamala points towards the door. Explore it while walking. Meenakshi asks carefully, you mentioned cancer. Should we say that exercise prevents cancer? No, that statement would be too broad. The Garcia and colleagues found significant inverse associations for several cancer sites. These included head and neck cancers, myeloid leukemia, myeloma, gastric cancer, lung cancer, liver cancer, endometrial cancers, colon cancers, and breast cancer. But clear statistically significant associations were not established for every cancer study. For example, the analysis did not establish a clear significant association for cancers including the prostate, kidney, rectum, esophagus. Therefore, the accurate statement is higher physical activity was associated with lower total cancer mortality, lower total cancer incidence, and lower risk of several but not all specific cancers. Physical activity does not replace appropriate screening, vaccination, where relevant smoking cessation, healthy weight management, or medical care. Doraisamy asks suspiciously, I know what comes next. After 150 minutes, you will ask for 300 minutes. After 300, you will ask me to walk across the country. And approximately 300 minutes per week compared with inactivity, Garcia and colleagues found associations with approximately 34% lower all-cause mortality, approximately 35% lower cardiovascular mortality, approximately 18% lower cancer mortality, approximately 33% lower total cardiovascular disease incidence, and approximately 15% lower total cancer incidence. But beyond this activity level, the additional difference became smaller and more uncertain. Fewer participants reported very high activity volumes. Therefore, the message is not everyone must perform as much exercise as physically possible. The message is the largest health return occurs when an inactive person begins moving. While reading the book Super Ages by Eric Topol, I came across a powerful observation. Imagine discovering a medicine that simultaneously benefited the heart, the brain, the skeletal muscle, the pancreas, the vessels, metabolism, adipose tissue, and the immune system. We would probably consider it as a major medical breakthrough. Regular physical activity influences many of these systems, but unlike swallowing a tablet once, the biological signal must be repeated consistently. The book also discussed the NIH Molecular Transducers of Physical Activity Consortium, or MOTR-PAC, which was being studying molecular responses to exercise across multiple tissues. This does not mean exercise is magical. This means exercise acts as a repeated biological signal. During and after physical activity, skeletal muscle increase the glucose uptake, insulin sensitivity may improve, mitochondria receive signals to improve energy production, blood vessels adapt to repeatedly increase in blood flow, cardiorespiratory efficiency improves, muscles release signaling molecules that communicate with other organs. Regular activity may help reduce chronic low-grade inflammation, strength, balance, and physical reserve can improve. One session sends the signal. Repeated session creates adaptation. Doraisamy asks with a genuine hope, so, if I walk today, can I rest for the remainder of the month? No. Doraisamy looks disappointed. Now, not even for 1 month. One walk is enough to begin. It is not enough to retire permanently from physical activity. Kamala says cheerfully, even your driving license requires renewal. Doraisamy sighs dramatically. This body has too many terms and conditions. Most people watching this video already know that physical activity is good. Knowledge is not always the problem. The difficult part is moving from mentally exhausting working day into deliberate physical activity. So the starting plan must be small enough that the tired brain cannot reject it. Kamala speaks gently and asks, Enanga, shall we walk for 10 minutes after dinner? Only 10 minutes just today. Doraisamy asks hesitantly, 10 continuous minutes? Kamala reassures him, 5 minutes away from the house, 5 minutes back. Doraisamy considers it carefully. That sounds suspiciously possible. And Meenakshi says encouragingly, I will also join you. Doraisamy asks very nervously, at what speed? Meenakshi explains, fast enough to raise the heart rate, slow enough that we can still talk. Doraisamy immediately looks concerned. Both of you talking continuously may become vigorous activity for me. For an inactive adult without a medical restriction, a practical beginning may be start with 10 minutes of brisk walking on most days. After 1 or 2 weeks, gradually increase the duration or frequency. You may walk for 10 minutes after 1 or 2 meals, walk during an appropriate non-confidential telephone call, use suitable stair opportunities, add a longer weekend walk, and interrupt prolonged sitting with short periods of movement. Gradually progress towards approximately 150 minutes per week. Brisk walking generally means that your breathing and heart rate rise, but you can still speak in sentence. People limited by joint pain may consider alternatives such as cycling, swimming, water-based activity, or an individually modified walking program. Aerobic activity is also not the complete exercise program. Adults should gradually work toward muscle strengthening activity on at least 2 days per week, according to their health ability and medical circumstances. Doraisamy slowly puts on his walking shoes. Kamala watches the present surprise. Meenakshi asks with exaggerated amazement, where are you going? Doraisamy answers proudly, for a walk. Meenakshi asks teasingly, how long? Doraisamy, 10 minutes. Meenakshi smiles, only 10 minutes? Doraisamy points towards the camera with scientific confidence. The evidence says the largest improvement begins when an inactive person starts moving. Please do not interfere with my research protocol. Kamala hands him a small rubbish bag and says calmly, take this with you. Doraisamy looks reluctantly at the bag. Why? Kamala replies seriously, functional strength training. Doraisamy protests, I agreed only to aerobic activity. Kamala opens the door and replies, this is cross training. Doraisamy walks out, muttering, science has entered every department of this house. Before we finish, here are the 10 important messages from part 1 of our exercise evidence series. Number 1, 1953 London transport study found lower coronary disease incidence and substantially lower early mortality among the more active conductors than among the seated drivers. Number 2, the London study was observational and historically important, but it did not prove that physical activity alone caused the difference. Number 3, in Moore's analysis of over 650,000 people, even up to 75 minutes of brisk walking equivalent activity per week was associated with approximately 1.8 additional years of estimated life expectancy compared with no leisure time activity. Number 4, the greatest relative importance occurred when people moved from no activity to some activity. Higher amounts produced further but progressively smaller gains. Number 5, the physical activity was associated with longer life among normal weight, overweight, class 1 obesity, class 2 or greater obesity groups. Number 6, in this analysis, a normal weight but inactive adult had a shorter estimated life expectancy than an active adult with class 1 obesity. Being thin is not the same as being fit. Number 7, among former smokers, 150 to 299 minutes of weekly activity was associated with approximately 4.1 additional estimated years and 450 minutes or more with approximately 5.5 years compared with inactive former smokers. Number 8, exercise does not cancel smoking. Smoking cessation and physical activity provide complementary, not interchangeable benefits. Number 9, Garcia's analysis of more than 30 million people found strong dose-dependent association with a lower all-cause mortality, cardiovascular outcomes, and total cancer outcomes, and several specific cancers. Number 10, you do not need to begin as an athlete. Start with an amount you can sustain. Progress gradually. And remember, some physical activity is far, far more better than none. The London bus conductors did not know about the Met hours, did not measure the zone 2. They simply spend more of their working day moving. That old study caught our attention. The modern evidence strengthens the message. But the most encouraging finding is not what happens at extreme exercise volume, It is what happens at the beginning. When a person moves from nothing to something, do not wait for perfect shoes. Do not wait for the perfect Monday. Do not wait until motivation arrives. Begin with 10 minutes. Your first walk does not need to transform your entire body. It only needs to change your direction. In part 2 of our exercise evidence series, we will examine another common question. How many steps do we actually need per day? Is 10,000 steps a genuine scientific threshold, or can meaningful benefits begin much earlier? We shall examine the evidence in the next part of this series. Until then, keep moving safely and consistently. Disclaimer: this video is intended only for general health education. It does not replace individual medical advice, diagnosis, or personalized exercise prescription. Exercise recommendations should consider a person's symptoms, medical condition, medications, mobility, and current level of fitness. Anyone experiencing chest pain, unexplained breathlessness, dizziness, fainting, or other concerning symptoms, and anyone with an unstable medical condition should obtain appropriate medical assessment before beginning rigorous exercise. See you in the next video, friends. Goodbye.